Welcome back to the channel. Today we're diving into a crucial topic that could save lives, especially for those of you over 65 or caring for someone in that age group. We're talking about your legs. And no, this isn't about how many miles you can walk or how high you can kick. This is about recognizing the subtle warning signs your legs might be sending about your overall health. Many serious health conditions can manifest in our legs, and ignoring those signs can have serious consequences. We often focus on our heart health, our brain health, but our legs, they often get overlooked. That's why I'm going to break down 5 leg warning signs you absolutely cannot ignore, especially after the age of 65. So stick around, because what you learn today could literally save your life or the life of someone you love. We're talking about early recognition, a crucial aspect of maintaining good health, especially as we age, because that's where the real power lies. The ability to identify and address issues early can significantly impact our quality of life. You see, our bodies are constantly communicating with us, sending out signals, sometimes subtle, sometimes not so subtle, to let us know something's up. These signals are our body's way of alerting us to potential problems. And when it comes to our legs, these signals can be early indicators of some serious health conditions. Conditions that, if caught early, can be managed or even prevented from worsening. Think of it like this. Imagine your car starts making a funny noise. It's a small sign that something might be wrong under the hood. Do you ignore it and hope it goes away? Or do you take it to a mechanic to get it checked out? Most of us would choose the latter. Or do you take it to a mechanic to get it checked out? Addressing the issue early can prevent a minor problem from becoming a major one. The same principle applies to our bodies. When we notice something unusual, it's important to pay attention and take action. Ignoring those early warning signs is like ignoring that funny noise in your car. It might seem insignificant at first, but it could be a sign of a much bigger problem brewing. It might seem like a small thing, but it could be a sign of a much bigger problem brewing. Small issues can escalate if left unchecked. Now, I'm not saying you should panic every time you feel a twinge in your leg. It's about being mindful and aware of your body's signals. But what I'm saying is that being aware of these warning signs and knowing when to seek medical attention can make all the difference. Early intervention can lead to better outcomes. It's about being proactive with your health, taking control, and not just brushing things off as getting older. Embracing an active lifestyle and regular checkups can help maintain your well-being. So let's get started and talk about the first warning sign: persistent leg pain. Understanding and addressing it early can make a significant difference in your health journey. Now, let's talk about the first warning sign: persistent leg pain. And I'm not talking about the occasional soreness after a long walk or a tough workout. I'm talking about pain that's always there, nagging at you, or pain that comes and goes but always seems to return. This kind of persistent pain can be a sign of a few different things. One possibility is peripheral artery disease, or PAD. This condition occurs when plaque builds up in the arteries that supply blood to your legs and feet. As the blood flow becomes restricted, you might experience pain, cramping, or a heavy feeling in your legs, especially when you're active. Another potential culprit behind persistent leg pain is a blood clot. If you experience sudden, severe leg pain, especially if it's accompanied by swelling, redness, or warmth in the affected leg, seek medical attention immediately. Persistent leg pain is not something to ignore. It's your body's way of telling you something's not quite right. The sooner you get checked out, the sooner you can address the underlying issue and prevent it from becoming a bigger problem down the road. Let's move on to the second warning sign: swelling in the legs, also known as edema. This condition can be more than just an inconvenience. It can be a signal from your body that something more serious is going on. Now, we've all experienced swollen feet or ankles after a long day, especially if we've been standing or sitting for extended periods. This kind of swelling usually goes away after some rest and elevation of the legs. But when the swelling is persistent, doesn't go away with rest, or is accompanied by other symptoms, it's time to pay attention. Persistent swelling can indicate underlying health issues that need to be addressed. Persistent leg swelling can be a sign of a few different things. It could be related to issues with your veins, heart, or even kidneys. One possibility is venous insufficiency, a condition where the valves in the veins of your legs aren't working properly, making it difficult for blood to flow back up to the heart. This can lead to blood pooling in the legs, causing them to swell. This pooling of blood can cause discomfort and increase the risk of skin changes and ulcers if left untreated. It's important to manage this condition with the help of a healthcare professional. Another potential cause of leg swelling is heart failure. When the heart isn't pumping blood effectively, fluid can build up in the legs, ankles, and feet. If you notice sudden or severe leg swelling, especially if it's accompanied by shortness of breath, fatigue, or chest pain, seek medical attention immediately. These could be signs of a serious condition that requires prompt treatment. If the swelling leaves a dent that stays for a while, that's called pitting edema, and it could be a sign of something more serious. Pitting edema can be associated with conditions like heart disease, liver disease, or deep vein thrombosis. Persistent leg swelling is not something to ignore. It can affect your mobility, comfort, and overall quality of life. So pay attention to your body, and if you notice anything unusual, don't hesitate to reach out to your doctor. Early intervention can make a significant difference in managing the underlying causes and improving your health. Chapter 4. We're moving on to the third warning sign, and it's one that's easy to overlook: changes in skin color or temperature. Now, you might be thinking, Dr. Mike, my legs are paler in the winter. That's normal, right? And you're right, some variation in skin color is completely normal, but what we're talking about here are more drastic or sudden changes. For example, if the skin on your legs becomes pale, bluish, or reddish, or if one leg is noticeably colder or warmer than the other, those are red flags. These changes in skin color or temperature can be a sign of poor circulation, which can be caused by a number of things, including peripheral artery disease, which we talked about earlier, or even diabetes. If the blood flow is severely restricted, the skin may even become cold and clammy to the touch. Another potential cause of skin changes in the legs is infection. If the skin is red, warm, and tender to the touch, it could be a sign of cellulitis, a bacterial infection of the skin and underlying tissues. So don't ignore changes in your skin, especially in your legs. Chapter 5. Let's talk about the fourth warning sign: non-healing sores or wounds. This is an important topic that often gets overlooked, but it can have serious implications for your health. Now, we all get cuts and scrapes from time to time, and most of the time they heal up without any problems. Our bodies are designed to repair themselves, and usually they do a great job at it, but when a sore or wound doesn't heal properly, or if it takes an unusually long time to heal, it could be a sign of an underlying health issue. This is your body's way of signaling that something might be wrong. One of the most common reasons for non-healing sores in the legs is poor circulation. Poor circulation can be caused by a variety of factors, including age, lifestyle, and underlying medical conditions. When there's not enough blood flow to the area, wounds don't get the oxygen and nutrients they need to heal properly, making them more susceptible to infection. This can create a vicious cycle where the wound gets worse instead of better. Another potential cause of non-healing sores is venous insufficiency, which can cause blood to pool in the legs, leading to swelling and increasing the risk of ulcers, especially around the ankles. This condition is more common in older adults and those with a history of blood clots. Any sore or wound that doesn't heal within a reasonable amount of time, especially if it's accompanied by other symptoms like pain, redness, swelling, or drainage, should be checked out by a doctor. These symptoms can indicate an infection or other serious issue that needs medical attention. Early detection and treatment are crucial when it comes to non-healing sores and wounds. The sooner you address the issue, the better the chances of a full recovery without complications. Ignoring them can lead to serious complications, including infection, amputation, and even sepsis, a life-threatening condition. So, always pay attention to what your body is trying to tell you. Chapter 6, we're on to our fifth and final warning sign: numbness or tingling in the legs. Now, we've all experienced that pins and needles sensation when we've been sitting or standing in one position for too long, but when the numbness or tingling is persistent, or if it comes and goes without an obvious reason, it's time to pay attention. This tingling, that numbness, it can feel like your legs have fallen asleep, but if it's happening frequently or without a clear cause, it could be a sign of nerve damage, also known as neuropathy. One of the most common causes of neuropathy is diabetes. Other potential causes of neuropathy include vitamin deficiencies, certain medications, alcohol abuse, exposure to toxins, and autoimmune diseases. If the numbness or tingling is persistent, if it affects both legs, or if it's accompanied by other symptoms like weakness, pain, or loss of coordination, those are all signs that you need to see a doctor. With early detection and treatment, you can often slow the progression of neuropathy and manage your symptoms. So there you have it, 5 leg warning signs you absolutely can't ignore, especially after the age of 65. Remember, our legs do so much for us, carrying us through life's adventures. It's time we start listening to what they're trying to tell us about our health. If you or a loved one are experiencing any of these symptoms, it's crucial to consult a healthcare professional immediately. And as always, thanks for watching. Stay healthy and stay informed.